Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. Today we are going to talk about Mare pregnancy with the title Fascinating Insights into Mare Pregnancy, Understanding and Diagnosing Pregnancy. As we are aware that there are 4 layers of the placenta. So early on in the pregnancy, pre-attachment of the embryo, we have yolk sac, chorion, amnion, and allantois. Then they form in the placenta. Placenta is a very unique organ, regardless which mammal we talk about. It performs many functions. For instance, it stimulates ovarian function, maintains pregnancy, influence fetal growth, stimulate mammary function, and assist in parturition. Now, all these functions are not applicable in all species, but the mare is very unique. I could just go ahead and show you this little table, which I think makes a very good point. So this table, as you can see, says the title is Gestation Length and Time of Placental Takeover for Progesterone Production in Various Species. Now, what does it mean? Let me share with you. In the mare, where we have a pregnancy of about 11 months duration, but the placenta takes over after about 72 days or so, or 70 days. You can see after about 2 months or so, a little over 2 months after that, placenta is in charge, because regardless which species we talk about, progesterone has to be produced and pregnancy is maintained with the help of progesterone. So the question comes in that is it progesterone is coming from ovary or is coming from placenta. So in the mare, I think it should be very clear that out of 11 months of pregnancy, placenta takes over after about 70 days. But just for curiosity, you see here's alpaca, which is small, camel, which has got a little over even 11 months of pregnancy, but the whole pregnancy is maintained on the corpus luteum of the ovary where the progesterone is coming from. And same is about the bitch and the queen. 2 months pregnancy, dependent completely on corpus luteum progesterone cow. 9 months pregnancy, but about almost 6 to 8 months of pregnancy is on the, after that placenta takes over. The sheep is 5 months pregnancy, and after 50 days, then placenta takes over. So you can see this is very fascinating, and this really makes me always stay interested in comparative reproduction. Now the goat, again the same thing, but all 5 months is dependent on corpus luteum progesterone. So you could see that even though we talk about many times sheep and goat, well, they are small ruminant, but they are definitely different in many different ways. And this is one of those ways that I just mentioned. Now, in the mare, again, placenta is defined as a placental, diffuse placenta. Means it has got microcartilagens, which are attached to the, the embryo or the fetus or the, the placenta, which exchange all the nutrients that fetus receives. And then the maintenance of that pregnancy is obviously the primary, what we call primary corpus luteum, comes right after ovulation. That area of ovum is now taken over by corpus luteum, which produces progesterone. But then another unique structure comes out, which is called endometrial cups, which is again unique with the mare. And that endometrial cups are producing another hormone called equine chorionic gonadotropin. The old name for this hormone was PMSG. So now it is equine chorionic gonadotropin, which forms and maintains the secondary corpora lutea. And that has a function like FSH. So if you look at closely in this picture, at least the bottom picture here, you could see there is a dark area in the middle, kind of, which is the fetus. And then you have, if you come down all the way, at the bottom says EC, and those are the endometrial cups, which is again very, very unique in the mare. Not other animals that we deal with have that. Now this figure you see, this diagram, which shows the primary corpus luteum, which I just mentioned. As you can see, it goes up to the, about 120 days or so, and then you have plus ECG comes in, and then we have accessory corpus luteum and the ECG, which maintains the pregnancy. Now look at the clinical aspects of pregnancy. What happens? Well, if we breed close to the ovulation, would be a good idea, because the ovum lives about 12 hours or so in the uterus. Now, after about 6 days post fertilization, that embryo comes down in the uterus and then attached to it. Now, obviously, progesterone is being produced at that time, so we have the closed cervix, and the uterine secretions are produced to maintain the health of that embryo. Another aspect, which is true with all the mammals that we deal with, including human, by the way, is called maternal recognition of the pregnancy. So this embryo tells the mother that now, she has her place in the uterus, so please don't get rid of corpus luteum or anything else which maintains the pregnancy. So in the mare, on day 7, the blastocyst really moves around in whole uterus, goes from one horn to the other, just trying to give a message to the hypothalamus pituitary gland that I'm pregnant. Please do not disrupt this pregnancy. So then after about 2 weeks, 15 to 16 days, that embryo lodges in one of the horns. Most of the pregnancies in the mare are on the left horn. So now comes to the pregnancy diagnosis or detection of pregnancy. Very unique. You can do it very early in the mare. In fact, as early as you can do it on 15 days, and then on 18 days you could see even the embryo. As you can see here on the left hand side, a little arrow there is the embryo, and this in between there's all this fluid, as you can see here. Ultrasonography is the best way, and you can see it very early, the heartbeat and everything else. Now, this picture happened to be on one of the farms that it was under our supervision in Louisiana State University. So sometime, you have situations where you don't have any complete restraint and everything else in the horse. This mare happened to be pretty docile. So when a student took a chance to go ahead and palpate her, as you can see, he is not standing behind her exactly. He's standing on the side and trying to feel the pregnancy. So from palpation per rectum, rectal palpation is best done somewhere around 18 to 20 days. So you could feel this bulge, which I'll show you a picture in a minute. And then the reason that time is really important, that if you're sure that mare is not pregnant, then I think it's time to think about breeding her again, because in 2-3 days, she's going to come back in heat. So here are, the drawings, which are very close to what you would expect to see. So on the left extreme corner up there, you could see a mare with the picture of the mare uterus, which is non-pregnant. You could see both horns are fairly symmetrical. And then you see at 28 to 30 days, the little, what we call bulge. And that is what you see on your right-hand side on the top. Then on the left side at the bottom, you could see that bulge starts increasing, and then after that, even increase even more. So that's really how we would be expecting to diagnose pregnancy on palpation by rectum. So now 60 to 65 days, you could feel that, the cervix is stretched down, and you have this size of cantaloupe or small football. So this picture is from Dr. Bernsko's book. those of you who are interested in equine reproduction, probably this manual, this is a very easy to read, and I would strongly recommend to have it on your shelf because it has got inside out of the equine reproduction that you need to know. Now then, as pregnancy advances, you can see 100 to 120 days that bulge gets really big, about volleyball or basketball size. Now, again, as I mentioned, that you could see the embryonic vesicle fairly early, in about 2 weeks or so, and the heartbeat comes around maybe around 25 days or so, and that's really the ultimate of pregnancy diagnosis. That not only do you recognize the embryo, but at the same time the beating heart, then you know that embryo is alive. Now, as I showed the pictures earlier, that at 100, 120 days, that bulge gets really large. So after about 80 days or so, you can even do trans-abdominal ultrasonography. So here, our student is using 3.5 megahertz probe to do trans-abdominal ultrasonography on this mare. I have listed you here the list of references. As I mentioned earlier, some of the pictures were from Dr. Sanger's book, which is the last reference there. Then the recommended book I was asking about, mentioning to you, Dr. Brinsko's book on the top. And those two middle books are also very, very comprehensive. If somebody really wants to dig deep in more detailed information, I think both books would be a good one to have them. With that, I'm going to stop with this video, and I look forward to sharing with you more information on equine reproduction. But in the meantime, please take care, and if you have got questions and comments, please send it to me, and I'll be happy to answer them. Until then, wish you well. Bye-bye.